missing many things. Okay, she's a very good student and she deserves A grade or at least B plus. Okay, if she gets A grade, no, I'll give you a gift. Say yes, sir. Missing many things. Chase her up. Okay, she's a very good student and she will listen to even a small boy. Okay, that is her nature. I'm not appreciating him. I'm not praising. I'm telling the fact. I want every student to be like that. Such students only bring name for our institution. I don't need anybody's. Okay, I bothered about the institution. That's all. Hello and welcome to Seven Sentinels. This is Grandmaster class and I'm Peter Simon with you. Today we are conducting writing workshop. This is for Dr. Alinda Manandhar, currently in Melbourne, Australia, and originally from Kathmandu, Nepal. Dr. B. Kumbar, urologist. Where is this daughter, Dr. Alinda, on the eye? Okay. Be very careful. Be very clear and specific. Southport Hospital, Gold Coast. What is this, GDD or is this GOLD? I don't understand what you have written here. Why are you giving me a confusion not to understand O and I can understand the difference between O and L and D. Why are you clubbing O with L and making it D? I find no difference in O and L and D. There is no difference. You just attach to it. Why? Stretch the words. Don't add the words here. You see? You see what is this? What is this? D. I cannot see O and L. So be careful in your presentation. They will not tell you. Okay, they'll just cut off your marks if it is not readable very fast. Then next one. 1 June 2010. Right? Gold Coast. Then next one. Regarding Tom Cribb, comma, date of birth, colon, very good. You are following the system. No space before colon. No space before colon. No space before comma. I told you and you are following. I notice the improvement. 25 May 1982. Very good. Dear Dr. Kumbar, right. Mr. Cribb, who has a severe nephrosis. A severe nephrosis. How many nephrosis will be there? 1, 2, 3. Can you count severe nephrosis? Unmute. Dr. Alinda. Dr. Alinda. Where is Dr. Alinda? Alinda is missing. What happened? Manandhar. Oh, you wrote Manandhar. Ah. Yeah, see. Write your name, no full name. That's why I'll get confusion.
Yeah, not able to mute myself. Yes.
Yeah, no problem. I muted everyone. No, otherwise everyone will unmute and talk something. So rename. So whenever you join, you not type like this Alinda Manandhar because see, I faced a difficulty for 1 second to identify your name. Come with this Alinda Manandhar. Everyone like that. Everyone come with your names, na? Everyone come with your names, full names. Arshia, many Arshias will be there. Kamal, many Kamals will be there. Right? Rani, 2 Ranis are already here. How do I know which Rani is our student? Okay. So, next one. Mr. Cribb, who has a severe, there is nothing called 1 nephrosis, 2 nephrosis, 3 nephrosis, 4 nephrosis, 1 malaria, 2 malaria, 3 malarias, 4 malarias. Do you think it's uncountable? Hydronephrosis is uncountable, right?
Yes, sir.
The disease condition, you cannot say 1 jaundice, 2 jaundices, 3 jaundices, 4 jaundices. Can you say?
No.
I have 1 fever, 3 fevers, 4 fevers. No. You should understand that when you are a doctor, you should apply. You have a lot of common sense. You can apply. Now I'm asking, you are telling the same thing you can apply. There's a lot of common sense which you can apply on your own. You don't need to depend on Simon sir. Simon sir is important for something else. Mr. Gill, don't feel bad. I'm shouting like this. I'm not shouting with anger. I'm shouting out of happiness. Okay. Right? So only for
Yes,
those
sir.
students who are very obedient, I will shout like this because I demand A grade or B plus from them. Everyone needs that one, but they should be obedient, first of all. Mr. Cribb, who has severe hydronephrosis of the right knee, comma, who will put comma here? Comma, Mr. Cribb, who has severe hydronephrosis of the right kidney, needs further evaluation and a CT scan. CT scan, don't you know the full form of CT scan? Why don't you write? Why are you writing in the note form? Write it full. It's an official
Okay.
letter. Okay, it is accepted, but doesn't mean that it is rewarded. Accepted means okay. Accepted means okay. Okay.
Mm-hmm.
It doesn't
Yes, sir.
mean it is selected.
Yeah.
Right. So computerized tomography scan. Okay. Mr. Cribb is married and has habits of smoking around 6 cigarettes. This is wrong. You cannot cut like this. Cigarettes.
The spelling is
Okay.
wrong.
What is the spelling of cigarettes? C
Cigarettes.
Cigarettes. So one is spelling mistake. There are two mistakes in this one. And you cannot separate this word like this. You can separate like this. So you can say cigarettes. So you can, there is only you can split. The rule number one is you can split where two syllables join. That joint you can cut. There you can cut. Reds, there you can cut. Reds is one
How
word.
do
It is not red taste.
Okay. How
So
do I
reds
put
cannot be broken.
how do I finish the same word in the,
Yes.
I
Now
mean,
what
same
you can do
line?
is, if you want to break this one, you cannot break it after CI because only two letters are there. At least 4 letters this side, 4 letters that side. So by default, you cannot cut here. So you can cut here only. Cigarettes. Like this you can cut. Now you understand.
Mm-hmm.
This is the way how you can split this word. Is that clear?
Yes.
So one is spelling mistake and one is splitting mistake. Both mistakes. Two mistakes are there here.
Yes.
Yeah. So he has habits of smoking around 6 cigarettes a day and drinking alcohol around 2.5 units per week. Okay. Now let me write this sentence for you because you deserve quality. So I'm explaining you. Try to use this next time onwards like this. Regular daily consumption of, okay, regular daily consumption of 6 cigarettes, regular daily consumption of 6 cigarettes. So here in the beginning, I am going to say not only but also. Have you used anywhere not only but also?
Yes, sir.
You have used.
Somewhere.
Okay. Yeah, you have used. I'm just adding here. Okay. No problem. Not only regular daily consumptions of 6 cigarettes, but also, you can change afterwards. No problem. But also, um, um, weekly intake of per week, weekly alcohol intake of all the other students get benefit. Don't think that this is not my letter, this is not nurse's letter, this is not my letter. Why should I waste my time? See, this is what it is. Somebody is okay. So you can try to write these sentences on your own. So whenever I am giving a session, please be available. Not only regular daily consumption of 6 cigarettes, but also weekly alcohol intake of 2.5 units. Okay, have been notified. Okay, that's it. So that has been informed, have been informed, or have been notified, have been mentioned. So she told already not only but also, she has written somewhere. So let us see where she has written not only but also.
I'm confused if it was in this letter or the other one, but
No problem. Let me see. No, we can confirm. No? So not only here it is there, not only but also. Yeah. So I can track. No worry. I'm there. So not only but also is removed. Both and. Now I can say both and. So I'm showing this. Now, how to write different sentences here? Okay. How to write a different sentences here? I'm going to show you this one. Not only, but also how many different styles you can write. So this is one. So not only, yeah, not only regular daily consumption of 6 cigarettes, but also weekly alcohol intake of 2.5 units, okay, have been notified. This is sentence number 1, style number 1. All of you learn. This is style number 2. Here we have used not only but also. Yeah, not only but also. So here we are using both and. So here also is not needed. Here we'll use not only but also. This is not only but also style. So in the first example, we have used not only but also. Second sentence, use both. In addition to, this is third style. Regular daily consumption of 6 cigarettes, comma, weekly alcohol intake of 2.5 units. Here you will use singular, has been notified. Here you will use has been. When you use in addition to, it will be singular. Okay. So you'll use singular. Because in addition to this is done. Both this and this are done. Not only this, but also this are done. So this is taken not only, but also is taken in the plural concept. Plural concept. Everyone, I'm teaching grammar. Okay. This is also taken in the plural concept. Okay. But this is taken in the singular concept. Singular concept. So try to understand, this is the rule. Because of this only many people do mistakes. Okay, this is plural concept. Danger zone. Instead of plural, you write singular, means you lost your mark. You'll get penalty. Yeah, be careful. In addition to, you can also write as well as. You can also write as well as. Regular, day. Why should I write all these things? Okay. So, yeah. Regular daily consumption of 6 cigarettes as well as weekly alcohol consumption of 2.5 units, okay, has been notified. This is also singular concept. As well as, likewise, you can also use likewise, okay, as well as, likewise. There are many styles you can use, okay, but if you have any confusion, don't use as well as, because many people don't know the concept of as well as. Okay, that means similarly, likewise. You can use similarly, okay, you can use likewise, okay. So many styles more that we'll see later. Step by step we'll see. Right? So that is enough for now. Then we are going to the mainstream. Both regular daily consumption of 6 cigarettes and also will not come here. Not only but also will come, or both and will come. Okay. Alcohol intake of 2.5 units have been notified. Yeah. Yes. So that's it. This is daily, this is weekly. That's all. Finished. See the quality of sentence. Is that clear, Alinda?
Yes, sir,
Yeah.
clear.
So try to use quality sentences. I don't want to use mediocre sentences like every Tom, Dick, and Harry who just wants to pass. I did not give you admission for just passing. You know that very clearly. Okay. So make it a rule that you add quality to. Just quantity is not sufficient. Right. Next one. He worked as the builder's laborer. He worked as the builder's laborer. The builder's laborer. Which builder's laborer? Okay. Yeah. The builders means that particular builders. No, it's not a particular builder. Then where is the name? How do you know? Which builder? The builder you are saying. Which builder? You're wrong. A builder's laborer. A. Okay. A builder's laborer, not the. You cannot use. Okay. Recently made redundant because of lack of work. Okay. Lack of work. Layoff. Layoff. He was layoff. He was given a layoff. That means removed from job. Now he works as a full-time office assistant. Why do you want to tell this one? He is unemployed, builder's laborer, recently made redundant because of lack of work. Is that needed? Why does the person who is receiving this letter need this information? Okay, you are writing to a urologist. What is he going to do with this information that he was working as a laborer, builder's laborer? It is irrelevant information or unnecessary information. Okay, is that clear, Alinda?
Yes, sir, clear, sir.
If you are a urologist, will you use this information for treating the patient?
No.
That is called relevance. Now you understand the importance of relevance?
Yes, sir.
Yeah, you are a doctor. You should judge what information is important to the other. You cannot give any garbage or rubbish to him. You are a doctor. I cannot give garbage or rubbish to you. I have to selectively present the material. That is called relevance and irrelevance. You have to distinguish. Right. There are three types of materials: relevant material, irrelevant material, and semi-relevant material. Maybe or may not. Doubtful, that one. So, next. He worked as a builder's labor. However, has been made redundant. No need. Whether he is redundant or whether he is no unemployed or he is builder's laborer, what will a urologist use that information? This is irrelevant information. How far is this useful? I don't know how to put this one in place. How far is this relevant? You should only tell me this bit of information. Okay. So this information. So I'll put here. How far is this relevant? So relevance. Is this information relevant? Yeah. Is this information relevant? Check it out. If it is relevant, you can put it. I don't see anything irrelevant there. Despite having no incidents. What is incident? What is incident? What is incident, Dr. Alinda?
Incidents.
Huh?
Incidents. Incidents, sir.
So you have spoiled my brain. You have raked my brain for a second because of your handwriting. Now, what should I consider? I only could not understand this. What will they think? For a second, I was perplexed. You disturbed my mind for 10, 15, 30 seconds. So now what should I consider this? This is considered as a spelling mistake or wrong word. That's it. A word which is not there in the dictionary, that word you have used. This can be termed as, confusion or chaos. Okay. So you are not careful to separate C and I, and you made it A. At least you did not put a dot on the I. Very clearly you confused me. You don't deserve that particular mark for this, and you deserve punishment for this. That is what they will punish. I was telling you time and again, I was telling you, why are you joining 2 or 3 letters? Spread. Even in running handwriting also, you have to spread that. Otherwise, it will create confusion. So despite having no incidents of abdominal trauma, episodes of excruciating pain in the right lower abdomen caused the initial presentation. Okay. On 2/5/2020. So this 2/5, write it as May. And 2020, do you first June 2000? What is this you are writing, my dear? You are writing the letter in 2010, and you are saying you initially presented in 2020. So you have the capability to throw the people into the future. You are walking into the future. You are writing the letter 10 years before, and he is presenting 10 years later. What do you mean by this? What do you mean by this, Alinda? There is some confusion. I don't know what you have done here. So be careful.
That's a mistake, sir. I wanted to. I actually wrote 2010, but I don't know what it is.
Yeah, now you got it. So you
Yes,
are
sir.
writing the letter when? So today's date is 1/6/2010. Okay, this is clear, correct. This is absolutely correct according to the case notes. Okay, where did 2020 come from? Where is 2020? Okay, this is my letter, my case notes. Okay, let us take your case notes which you have given. Is there, let me check.
No, it's 2010, sir. That's a mistake.
So that means it is your mistake, right?
Mm-hmm.
You could have avoided this mistake if you had been careful, right?
Yes, sir.
So you accept that you are not careful, right?
Yes, sir.
So that means you are careless, right? So carelessness will be punished in the OET, okay? Be very careful. I'm telling you, I'm not telling you anything. I'm not telling you anything. I'm just telling you to be careful. That's it. Don't get punished. I want to save you from that disaster. Yeah. So, although, is there a comma here?
No, actually, I erased it.
But you did not erase it properly. Okay. When you are erase it with care so that not even a trace of it will be there. Now it is considered a mistake. Although nausea was reported, comma, there were no urinary complaints. Urinary complaints. Yeah, fine. Mild degree. L should be a same height. L should be same height as a D. It is down. L should go up. And M is messed up. Mild degree of tenderness. OF. Is this OF? I don't know what you have written here. D. I don't know what is it. It looks like D for me. See? It looks like D. Confused. Of tenderness on the right lower abdomen was revealed. Mild degree of tenderness on the right lower abdomen. The right lower abdomen. Yeah, was revealed during examination. This during examination you can write in the beginning.
Okay.
You use one word called auscultation. Can you use the word auscultation to this?
No, sir.
Okay, you can write this upon examination in the beginning.
I can say palpation.
Huh?
Palpation.
Yeah, you can say. Now you know, no? When I gave you thought, you
but
gave
I've already put
okay,
it.
okay, fine. That's fine. So here, that's fine, no problem. During examination, during physical examination, comma, that should come forward. Because that is more important in the forward, beginning, right?
Yes.
I found a friend. I made a friend when I went to Calcutta. So That is not very important. When I went to Calcutta, I made a friend. Now see the impression. You understand now?
Yes, sir.
You should give the background first and then tell what happened. Background is examination, right?
Mm-hmm.
So bring that forward. It will add quality to it. During physical examination, comma, mild degree of tenderness on the right lower abdomen was revealed. Finish. Is that clear?
Mm-hmm.
Your sentence is correct, no doubt. But quality-wise, you did not stress on that one. Physical examination, okay? Right.
Mm-hmm.
You gave importance to mild degree of tenderness, but this is more important. How did you know that it's mild degree of tenderness? Upon examination. So examination should come first. Is that clear?
Okay.
Yeah. Last year, I went to Madras. How very strong it is. I went to Madras last year. It is dry. I went to Madras last year. Last year, I went to Madras. Is that clear now? The stress.
Mm-hmm.
Give that stress wherever it occurred. Next one. Consequently, intravenous pyelogram and urine tests were done. So here, which is wrongly placed? Which should come here? Consequently, intravenous pyelogram and urine tests, which were ordered or which were performed, which tests which were performed, done which is wrong, tests which were done, tests which were done, tests which were performed. But what you said, urine tests were done, which showed, done which showed, which is a relative pronoun, it should be immediately next to the noun. There is no doubt regarding that one. So which should come here? Tests which, so comma, which were performed, comma, revealed or showed, revealed you already written. Okay, showed. So that's it. Enlarged right kidney. Okay, showed enlarged right kidney and a few red cells respectively. Very good. That's awesome. Today, although there has been no reports, reports is plural. You have to say there has been no report or there have been no reports. What are you communicating here? Has been no report or have been no reports. So you should understand whether it is singular or plural. This agreement is missing here. Has been no reports. This is a mistake here. Has been means singular. No reports means plural. So there have been no reports or there has been no report. Be very careful of unbearable pain. Okay. Anyone you can select from this. Some mild pain which was alleviated by consuming paracetamol. Paracetamol, confusion here. I don't know where is C here. Some mild pain which was alleviated. See here it is correctly. Pain which was alleviated. Very nice. Here you did not write some mild pain was alleviated, which was. You did not say like that one. Here you wrote correctly. Then why did you not write here correctly? Which? So you know that, but you missed there. Okay. Has been noted. Here you have to put comma. So which was alleviated by consuming paracetamol, comma, has been noticed. Pain has been noticed. That's it. The next one. Ultrasound has shown not only hydronephrosis, no need comma, but also some mass attached to the liver. Fine. Additionally, digital rectal examination has shown. Why so many times shown? Huh? Why shown? I am pointing out your weak areas, vulnerable spots. Huh? Somewhere else also was there. Has shown. Has shown. Okay. Shown. Test to the liver. Shown. Okay. Yeah, before maybe. Okay, fine. Shown. Why are you using so many times shown? Use some other word, alternative. Find out, discover. Shown both hard mass and also the kidney lowered than its usual place. Lowered kidney. Okay. Unusually lowered kidney. Unusually lowered kidney. Finished. Unusually lowered kidney. Finished. 3 words. Why you want to expand that? Okay, this is corrected. There is no mistake in that one. Enthusiasm to join the previous job. About to resume in 14 days has been noticed. Enthusiast to join the previous job. Enthusiasm to join the previous. How can it be joined? Enthusiasm to resume the previous job in 14 days has been noticed. Why, Dr. Alinda, you are pulling and stretching it? Enthusiasm to rejoin or resume, there itself is in it. Enthusiasm to resume the previous job. Okay. Enthusiasm to resume the previous job in 14 days has been noticed. Okay. Has been expressed. Expressed. You can say here, enthusiasm to resume the previous job in 14 days has been expressed. Better word. Correct only. What you are writing is correct only. I'm not saying it is wrong. Has been expressed. Okay. Yeah. In light of the above, your expert opinion for a definitive diagnosis. Your expert opinion for a definitive diagnosis. Opinion for a definitive diagnosis, there is no question of opinion. It's not an opinion. It's a decision. Decided. Where is opinion there? You have used the wrong word. We don't want his opinion. We want standard. We can also give our opinion. Then why do we want to contact him? Opinion, no. Not opinion. Your expert guidance, you can say. Expert guidance. Okay. Change the style. This opinion is not suitable. You're going for a specialist and you're asking for an opinion. If he's going to give an opinion, why we want him? He should give a solution, not opinion. Based on a definite diagnosis. That's it. Your expert guidance, you can say. Give guidance. You can give guidance, no problem. Expert guidance, comma. This is number 1. Guidance is required. Okay. Comma. Definitive diagnosis and appropriate treatment, an appropriate treatment, a treatment plan. Yeah. Would be profoundly beneficial. Very good sentence. That's correct. In light of the above, your expert guidance, definitive diagnosis, and treatment plan would be profoundly beneficial to manage the condition of whatever the name. What's the name? Man is the condition of. Yeah, Tom Cribb. Condition of Cribb. Mr. Cribb. Effectively, something, whatever you want to write. Otherwise, this is fine. In case any additional information is deemed extremely relevant, please do not hesitate to contact whom? Contact whom? Contact us or contact me. Full stop. And yours sincerely, I really appreciate your style. Not too many mistakes. Not too many mistakes. There are no mistakes at all, first of all. Okay. This is a pass mark, no doubt regarding that. It gives you something like 380. But I don't want 380, nah? Otherwise, I would have finished your letter. If I want 380 for you, I would have finished your letter in just 5 minutes flat. Appreciate the quality which is given you and try to give, okay, my due, that is excellent results. Okay. Yeah. Any doubts for you, Dr. Alinda?
No, sir. Doubts have been cleared.
There are not too many mistakes. Okay.
Okay.
Not too many mistakes. Fingers on the fingers, 5 fingers. Mistakes are on just 5 fingers. That's it. This is.
But I'm finding it difficult to improve my handwriting, sir.
Improve your handwriting. Okay. There is no life and death risk here. You are going for driving also, right?
Yes, sir.
Here you have to risk your life, but here no risk your life, no? So they expand your interest. That's all. Okay.
Okay.
Otherwise, you can buy a 4-ruled notebook and practice. Huh?
I've been practicing.
Yeah, you are practicing. I can see the difference earlier and now. A lot of difference is there. First of all, you are scared of me. I know that one also because Simon sir will shout on the video. Correct or not?
Yes, sir.
He'll not bother about anything. That's you know very clearly. Your problem is what? Not small things. Your higher level mistakes. These are called as higher. This I'll give you an abbreviation. Okay. I'll give you an abbreviation. This is called, the problem with you is this one, not ordinary mediocre. It's a HOTS, HOTS. This is your problem. You lack this one. You lack these HOTS. What is this HOTS? HIGHER, higher order thinking skills. I termed this word. When I was doing my PG, I termed this word. HOTS. Higher order thinking skills. That is what you lack. Okay. Otherwise, everything is fine. Improving the quality of the word, suitability. This is higher order. Not everyone can. The next one here. Noted. Correct only. Expressed. Words change. Join, you said. I said resume. This resume you brought here. I brought here resume. That's it. Minimizing, compressing, concising, precise, brevity, we call. So that's another problem. This higher order thinking skill. Okay. Here has been no reports. So this is one grammatical mistake. One mistake now. And here repetition, higher order skill. Repetition, avoid repetition of the words. That's it. Okay. The next one. This is only one mistake till now here. Grammar mistake. Then here, second grammar mistake. Which were performed, showed enlarged. What did you do? You wrongly placed which instead of here, here. Which should come immediately after. He is the man who helped me. This is the place which I wanted to visit. Place which. That means it should be immediately. It should be immediately after the noun. That's it. There's grammar mistake. 2 mistakes. And third one, you don't know that in official letter may should be written in words. Formal, the name of the month has a perfect name. Why don't you write that one? 12 doesn't have any name. 2020 doesn't have any name. But 05 has a name, special name called May. It is shouting at you. You don't know that. I have a special name. Why are you calling me as 05? I'm not only 05. 05 is secondary name. My main name is M-A-Y, May. So that you don't know. So that is another problem. Next. Yeah, here. This is, you have to be careful. Okay. This is relevant information or irrelevant information. Okay. Otherwise, I don't have any mistakes in your letter. Not only 2 mistakes. See, only just 2 mistakes. This is what confusion. This is not a mistake. This is, you created some confusion. GDD cost. What is this GDD cost? I don't know. And here you wrote something else like that. Inardents. I don't know. I was about to check in the dictionary. Anything is there, because a doctor cannot make such a silly mistake. I was about to take a dictionary because I don't know what you have written. Okay. I was believing that doctors cannot do such mistake. So maybe she knows this particular word, because many students taught me many words which I do not know. So I thought that you might have written a word and I don't know the word. Then when you said it is incidents, then I realized, oh, this dictionary is not, this may not be in the dictionary. Then I realized. Okay. So that is a silly mistake. How can you do that? You are doing injustice to yourself. You lost 10 marks here. Okay. This okay, they will not bother much. But you lost 10 marks here. And people are crying for 10 marks. That's it. I don't mind whether you are a doctor or a professor. I don't mind. You are for me a student. That's all. So I'm telling you all the things. However much, open your bag. A big bag, you'll get many things. Small bag, little things. That's it. As you open your purse, I can put cash into it. Okay. If you're open hearted, I'll put all my love in that one. That's it. Many students, they don't even call me. So what I will do? That's it. Okay, fine. I hope you understand this. If you have any doubts, you can message me. Otherwise, this particular letter, this is done. Yeah, right. Hello and welcome to Seven Sentinels. This is Grandmaster class and I'm Peter Simon with you, the trainer with a difference. Here, we love our students and we love our profession. We try to give quality rather than just blah, blah, blah things. We want quality. And if you are serious, you're genuine, and you are desirous, you have a burning fire to clear the OET in the first attempt, then come to me. Otherwise, this is fire. Stay away. It will burn you. So we have places, 2 more places for doctors, new batch. Nurses are, seats are filled. You can contact me, and the number is here. Yes, Grandmaster class. So we appreciate your participation. We train, you learn. Wisdom we earn. We'll achieve success together. We are a team. Grandmaster class. And this is my contact. Yeah, the number is there. WhatsApp. Just you click on that and you can get back to me. WhatsApp.me 91 India number 9877867360. You can contact me on this. So this is the number here. 9877. You just click on this and it will take you to my WhatsApp directly. Okay. It will take to my WhatsApp. So you can send a message. And if you're really serious, you can. Yeah, but one thing is, those who are already working need not come to me, because we stopped giving admission to those students who are already working. Because we want people who are dedicated. See, Dr. Alinda Manandhar, she's not working. She only dedicated this time for studies. Dr. Arshia, she dedicated for studies, because then only I can help you, shape you, mold you, train you, and make you a fine diamond, because you are proved, you deserve. That's it. Yes, the session ends now. Yeah. So sorry, I did not give you this from this side. Yeah. So right. So here you are. Now this is the situation. This is your situation. So this is the yeah, I wanted to give you the link. Yeah, so this is the WhatsApp number. Just click on this. It's a link. Just click on this, directly you'll get it. Or this is the number 9877867360. Contact me. Yes.